Republic TV. I'm Ridhumanan Bhardwaj. Viewers, we talk today about something that has infected and started impacting the entire nation. There is a flu-like situation that has gripped the entire nation. To really understand what this H3N2 virus and other such viruses are, we're joined by our guests today, are renowned doctors, to really get a sense of what lies ahead and the precautions that need to be taken. I welcome today on the show first Dr. Ganesh Kumar Mani, who's joining us from Delhi. He's a Padma Shri recipient, very famous cardiac surgeon who's devoted a lot of time, effort in achieving zero mortality. I introduced Dr. Srinivasan Ramanathan, Head of Department of Critical Care Medicare, Leelavati. He's live from Bombay. Mumbai. We've particularly seen he's been a COVID warrior, a front runner in the pandemic, also someone who manages extremely complicated medical and surgical patients in intensive care. We're also joined by Dr. Nandita Palshetkar, renowned gynecologist, fertility expert, director of Bloom. She's one of the pioneers of IVF in the country, world-renowned gynecologist, and someone who's introduced path-breaking technologies in India. Dr. J.D. Mukherjee joins us, Principal Director, Head of Neurology, Max Healthcare. He served the armed forces for 23 years, has also been awarded the Chief of Army Staff's Commendation Medal in 2004 and has over 40 years of experience. Dr. Nitin Verma joins us live from Delhi, Director of Madhukar Rainbow Children's Hospital, live from Delhi. He treats pediatric illness from emergency medicine and to pediatric nutrition. More than 30 years of experience, he is Delhi's go-to doctor for children. I also introduced Preeti Kumar, who's joining us, a patient who herself and her family have suffered from influenza. Viewers, I welcome these guests because these are doctors who are really going to take us today to try and understand the symptoms of the influenza and what we need to do to protect it. I first go to Dr. Srinivasan, who's been heading this, who's been seeing a lot of critical care patients in the ICU. Dr. Srinivasan, a lot of people today are saying that this could be a seasonal weather condition and occurrence, but people are facing a lot of respiratory infections. If you can tell us what are the type of influenzas you are seeing, what are the symptoms that you're currently seeing in the ICU, sir?
It's just been baffling after the COVID pandemic that we have had. This is a kind of a phase that we are seeing almost for a month now. What we are seeing is that there are a lot of viral infections, and generally would relate, and textbooks have always taught us that, influenza is an epidemic or a pandemic. The surge is always seen during winter months. But just at the fag end of the winter, what we are seeing is that the spike has been phenomenally high. The large variety of population is affected, both the immunocompetent as well as the immunocompromised, And we are seeing a lot of viral pneumonias requiring hospitalizations, which is very, very unusual. All right, most of them visit the general practitioners and they don't reach up to the ICU, which is why, in any given cross section I see, even in my clinical practice, I see at least 3 or 4 patients who are simultaneously admitted at the hospital with the viral infection, and it is very, very unusual to see. Most of them are influenza, which are A or B types, sometimes the para-influenza types. But yes, they do not have the mortality which is comparable to the H3N2 or the COVID type of viral infections. But yes, we do see this as a nuisance value, to a lot of people. Most of the households, almost everybody in the last 1 month has not been spared of a cough or a cold or, something which is upper respiratory or lower respiratory, to be very honest.
In fact, as you say that, I'm going to do a perfunctory cough because that's something I'm always inflicted by, but it's getting more. I want to also ask Dr. J.D. Mukherjee. Dr. Mukherjee, we've seen so many people come forward. They say there should be a vaccine for this. There should be some sort of a flu vaccine or flu shot that needs to be taken. Are doctors taking it? And what is the kind of flu vaccines that need to be taken by normal people in India today?
So thank you very much for this wonderful question. So we must remember that influenza vaccine is available and everyone should take it, whoever can take it. And it is quite effective because not only it is a tetravalent which is available in the country at the moment, and it influences the course of the disease and it protects. It is not going to protect 100%, but it substantially brings down the symptomology. So for example, the current viruses which are going on is H1N1 or H3N2. So if the vaccine is for H1N1, it also protects to H3N2 to some extent. So it mitigates the symptoms that one gets. So influenza virus is mandatory for us in our hospital where we work. It's part of our regulatory requirement. Every health worker is vaccinated against influenza virus. That is our policy in the hospital.
Wonderful. So that's something we need to take into consideration. I also want to go across to Dr. Ganesh Kumar Mani, Padma Shri recipient, who's also joining us. Dr. Mani, in your experience, this is spreading. We're seeing that this is spreading. What are the kind of precautions that India can take? Especially, this is becoming a cause of alarm because the central government has also written to the states that proactive steps need to be taken today to ensure this influenza spread is stopped.
Well, I agree with them. This is a fast spreading virus, person to person spreading, and it rapidly becomes a pneumonia, as told to by my predecessors. It's not as dangerous as COVID, but maybe we are seeing more incidents because we have completely gone off our COVID protocol. And we have even seen some deaths in immunocompromised individuals, like patients who are diabetics, elderly, or those who are on chemotherapy. The treatment that we recommend is only rest, paracetamol, and some cases, of course, Tamiflu can be given. The prevention is a hashtag in itself, H3 and N2. H3 stands for hand washing, handkerchief, using a handkerchief all the time, hospital preparedness. These are the three H's that I can think of. And N2, promote the namaste culture instead of handshakes, and say no to crowds. And of course, vaccination is the victory sign, and it's an inactivated virus. It's fairly safe. There doesn't need to be any controversy whether to take it or not. There's also a nasal spray coming in, which will be probably less effective, but I think it is reserved for high-risk individuals. And of course, the vaccination is the name of the game, but person-to-person contact has to be avoided, and that is why we can prevent unnecessary hospitalizations. Hospitals have to be prepared.
Yes.
Thank you.
Absolutely. Thank you, Dr. I also want to go to Dr. Nitin Verma. Dr. Verma, several children today in Delhi and in Mumbai, I see sometimes classes shutting down, sometimes the school is shutting down. The influenza is becoming extremely, almost like something that is spreading like wildfire. What is it that children and parents need to do to ensure that they can prevent this in children?
So honestly, I'm a little surprised that we are reporting it now, because we've actually been seeing this for the last 3 months. There was a stage where we were getting, at least I was getting 8-9 positive H3N2 children a day. So the spread, as one of my colleagues has said, it's extremely contagious. It spreads from one to the other. And children are impacted because when somebody in school has it, then, there are multiple children who are sitting in one classroom and they pick it up from one to the other. The importance, Dr. Mani said that, treatment is essentially symptomatic, but diagnosis is something which is extremely important, because if you diagnose, then you can prevent the spread. An Indian household has a mother and father, a child, grandparents, and it spreads rapidly from one person to the other. The vaccine, as Dr. Mukherjee said, is a quadrivalent vaccine. It contains one type A, one type B, H1N1 and H3N2. But our experience has shown that, probably the H3N2 virus, which is prevalent now, has mutated, because almost 80% of the children who got H3N2 influenza had taken the influenza vaccine. That does not take away from the fact that one of the most important ways to prevent it is vaccination. The flu vaccine is a new vaccine which comes out every year. The latest vaccine, which has come out a week back, has a new H1N1 strain. So stay in touch with your doctors, take your flu vaccine regularly, be very, very clear. It's a killed vaccine. It doesn't impact immunity. Everybody should take it. It's simple, it's inexpensive, has very few side effects. Knowledge of H3N2 and other viruses is important because we have to prevent the spread. This has been a prolonged, I think, in my 40 years, it's perhaps the first time I've seen such a prolonged influenza season. But hopefully now with the weather becoming a little warmer, we may be towards the fag end of it.
Thank you, Dr. Verma. I also want to go across to Dr. Nandita Palshetkar. Ma'am, several times it's said pregnant women are going to be more impacted by this. What is the kind of advice you're giving to women, who come to visit you and, they're pregnant? Sometimes they just want the best advice. How should they protect themselves?
Important advice that I can give all my patients is prevention. I think we really have to work on prevention, and the vaccine given during pregnancy, it's very safe. It can be given anytime during pregnancy. And what one has to understand is that the effect of influenza on the pregnancy. See, if it happens early, there can be abortions because of the fever, etc. But during the later stages, you can land up with early labor, preterm birth. Then the baby can be a low birth weight, and there can be a fetal demise. The baby can just pass away. So these are some of the side effects. And of the swine flu, the mortality of the mother if she gets pneumonia is very, very high. So I think we need to really take care that first, vaccination. Second, as I think doctor has said, the 3 H's: hand washing, handkerchiefs, and absolutely no to crowded places. And we have to be careful, especially during pregnancy. And I think we've learned it the hard way. From COVID, we've learned that we must take care of this. We must maintain hygiene, when you cough into your elbow, and you wear a mask when you're in a crowded place. I think all these precautions need to be taken by pregnant women because they're very vulnerable, and their immunity is slightly at a lower this. So if they catch the virus, it is much, severity is much, much more. So we have to, it's a high risk population that we are talking about, pregnancy and influenza.
Absolutely. Very important advice there, because one thing, Dr. Palshetkar, you've said is that even pregnant women can take this vaccine. So extremely crucial information coming, viewers of the show today, because this is an influenza-like illness where there's a severe acute respiratory infection. I also want to go across to Preeti. Preeti, you've suffered from this. Your family has suffered from this. Tell us the symptoms that you had.
Symptoms were a lot like a viral, a very high fever, respiratory distress, cough, cold. But I think what stood out and what got us all to test that why it looked a little different was just a very different level of exhaustion and tiredness. And I think that for us especially, and I don't know if I can speak for the general, but for us as a family, I think the level of exhaustion was far more than what we experienced during COVID. And so therefore the tests were done. But I would say just with viral and accompanied with extreme exhaustion.
Yes. All right. As we're also going to say, Preeti, I want everyone in India to be taking it safe. Dr. Srinivasan, I have another question for you. This is a virus that's circulating in the country. Today, there are 150 cases more being reported of the acute upper respiratory tract infections. Your best strategy then, as you said, is to stay vigilant. But we're also seeing some, deaths happen. What are the real precautions that can be taken immediately to ensure that such a situation is not reached?
Yeah, gone are the days where we would probably label any upper respiratory tract infection as a common cold. Now, each of them have an etiological diagnosis. It's either a COVID type of a virus, or it's an influenza or a para-influenza virus. In last 1 month, we have seen adenovirus and a lot of viruses, which probably never came up too much into the diagnostic modality. But then nowadays, with the latest techniques that COVID has taught, the PCR techniques, we are able to have this syndromic diagnosis through newer investigation technologies. So I think a lot of the common cold is no longer common. I think it's all, everything has to be labeled as a pneumonia or a upper respiratory tract infection because of a definitive virus. And that is what I want to say is that, every virus needs to be named. There are a few antivirals which we have been using, like, oseltamivir, which commonly called as Tamiflu in the country, and that is the something which works even for most of these infections. So early visit to a doctor if the fever is high. If you are an immunocompromised host, visit them early. If you are at extremes of age, children as well as the elderly population should visit a doctor early and try to arrive at the diagnosis and maybe take the antivirals if so indicated.
Absolutely. Yes, Dr. Srinivasan, I thank you for that. In fact, like Dr. Mukherjee said, viewers, it's time for your annual flu vaccination. Dr. Palshetkar said pregnant women can also take this vaccine. Several precautions being given by Dr. Verma, who says it's been prevailing for a long time. It's time to really take this seriously, have your hygiene. Like Dr. Ganesh Mani said, it's very, very important that even in crowded areas, one has to be extremely careful. Preeti, I also thank you for being on the show. Viewers, this is something we'll continue doing at Republic TV to ensure that this influenza virus does not spread. Thank you for watching us. A big, big thank you to the very renowned panel of doctors who joined us on Republic TV today.